The more recent co-registration studies comparing fMRI signals with EEG signals report that the greatest signal correlation between the two occurred when the slow to fast wave ratio of the EEG signal was used. Good stuff. The more recent co-registration studies comparing fMRI signal with the EEG signal report that the greatest signal correlation between the two occurred when the slow to fast wave ratio of the EEG signal was used. As blood perfusion decreases and resources to the brain decrease, high-frequency EEG activity drops out and slow-frequency EEG activity increases. This is a basic metabolic pattern that informs all disorders to some extent. Anxiety increases metabolism and beta frequency, resulting in a decreasing of the slow to fast wave ratio. But when the brain is burdened by excitotoxic or inflammatory events, it loses its ability to produce beta frequencies and slow wave activity increases. Many disorders such as ADD, Parkinson's, dementia, stroke, TBI, and so forth result in increasing neuroinflammation and the attending slow wave activity. This suggests we should be able to see a reflection of this pattern in the qEEG. Roy John, in his initial publications regarding neurometrics in the journal Science, actually presented images describing just such a pattern. For many, qEEG has been confusing as they look at each disorder and corresponding map as a unique event and condition, rather than a snapshot of a process. I propose that we can describe most maps as reflecting a stage in an ongoing oxidative stress pattern that generates progressive neuroinflammation. For example, in this particular snapshot we have in front of us, we can see a progressive sequence of degradation of neural functioning starting in stage 1 and working all the way through stage 8. At the beginning, what a person first experiences with the onset of anxiety is an asymmetry in beta. And we can see here that in this map there's a strong beta asymmetry in the initial first stage. However, beta does not always show up in the first map of somebody with anxiety. The asymmetry, according to Davidson, Heller, and Engels, and others, is a more clear and efficient marker of the onset of anxiety. But over time, as anxiety increases and the brain progressively desynchronizes from alpha into beta, we often get what shows up here in part 2. Stage 2 shows a deficit of alpha and corresponding increases in beta, particularly frontal beta and left frontal beta, which is associated with worry, according to the work of Engels et al. If we look at stage 3, we can see that at a certain point, beta completely dominates the map. And we can see that the alpha is starting to come back to a normal state of affairs. This is because alpha is actually increasing at this point due to slowly tiring sodium pumps. As we move into the next stage, stage 4, we begin to see that the alpha is actually increasing in a diffuse pattern across the entire scalp. This is typical of people with advanced anxiety. So stage 3 would be chronic anxiety. Stage 4 would be a more advanced anxiety that's beginning to turn into depression. At this point, we have such a high level of oxidative stress and inflammation. The diffuse inflammation is affecting mitochondrial function, ATP output, and sodium pumps are beginning to fatigue. That's why we have the diffuse alpha. By stage 5, we can see that we have alpha dominating with the beginning of increasing slow wave activity in delta and theta as inflammation progresses. We also have the beginning of the loss of high frequency power. Beta has diminished to the point where it looks almost in the normal range, but is also beginning to fall below the normal range. By stage 6, we can see that the beta frequencies have dropped out significantly, especially in the frontal region. Diffuse elevated alpha is beginning to slow. If we looked at dominant frequency measures, we'd find that this alpha was on the nature of 8 cycles a second. The neuroinflammation is developing progressively more, and theta is beginning to show up more in the map as perfusion diminishes. By the time we get to stage 7, we have a considerable amount of deficits in perfusion in the brain. Theta is starting to dominate as a diffuse event. Alpha is still there. By the 8th stage, even alpha is beginning to diminish, and theta and delta dominate the map. And this is often the type of map we see in Parkinson's and dementia. The stage 5 is more the type of map we would see in somebody with depression, particularly if it was precipitated by a lack of thyroid T3 and the inability to maintain sodium pump efficiency. So we propose altogether that this is a whole progression of events, and when people are traumatized physically or emotionally, they can be catapulted into any one of these stages and progressively decline or recover based upon the assistance they get. Now, if this is all true, we should see a correlation between metabolic scores, that is, scores that we compute regarding a person's overall physical health, and their oxidizer pattern in the qEEG. And to look at this, we actually took a sample of clients from several clinics and reviewed their maps to see whether they were dominantly fast wave or slow wave. And then we looked at a hair analysis to see if they were dominantly fast oxidizers or slow oxidizers. In oxidative stress models utilized in hair analysis by Dr. Watson and others, the concept is that people who are fast oxidizers have more sympathetic process, and that they metabolize faster. Whereas over time they begin to fatigue, and using Hansel's general model of alarm resistance and degradation of the system, failure of the system, they see the slow oxidizers as occupying a slower level of metabolic rate as a consequence of metabolic fatigue in the entire system. So to check this out, we looked at fast oxidizers, and we saw how many of them had fast wave maps, and slow oxidizers, and how many of them had slow wave maps. And then we compared them using chi-square, ordinal level of analysis, a statistical tool that's very appropriate for this type of assessment. We found that we got significant levels of difference between the two groups. And we also noted that when we looked at the average metabolic score between the two groups, the fast oxidizers had fewer metabolic problems than the slow oxidizers. So clearly this suggests a time sequence wherein people initially develop fast oxidative rates with fewer problems, but then as problems progress, move into more slow oxidizer states as they offer resistance over time and eventually fatigue and fail in the later stages. What was interesting in this analysis is we also found that the people who had the most resistance to neurofeedback and also had a lot of oxidative stress problems were people who had large amounts of aluminum in their system. 86% of this population that we looked at, which was resistant to neurofeedback, had elevated aluminum levels. In the PowerPoint frames that follow, we're going to be making comparisons between qEEG and states of anxiety and depression, and we're going to use the interactive self-inventory as a measure of anxiety and depression. It has an anxiety and depression scale. We ran factor analysis on the ISI, and the anxiety and depression scales held up very well. Their alphas were excellent, so we know that they're valid. And here you can see the covariance between the Beck inventory and the depression and anxiety measures on the ISI co-vary nicely. Well, one of the first indicators in the qEEG of somebody suffering stress is often elevated posterior alpha. This usually indicates that the posterior cingulate is not active as it needs to be, and that people tend to get stuck on particular situations or ideas. Often it's an indicator that people are constantly running a to-do list in their head, or thinking of ways to avoid difficulties and problems. This almost obsessive perseverant activity is the precursor to anxiety and rumination. Now, as I said at the beginning, beta asymmetry is a better marker for anxiety than beta magnitude. This was shown by the work of Davidson, but particularly by the work of Averin. Heller, in particular, in the late 90s, did research showing the correlation between beta asymmetry and anxiety, and then Engel's work years later on also confirmed those findings. Here is a sample of some of the research regarding asymmetry and anxiety. This is particularly important because it's developed the work of Wendy Heller into a more refined perspective regarding EEG and anxiety. They found 3 kinds of anxiety with 3 specific patterns in the brain, and we're going to cover those in just a minute. I'd like you to keep in mind as we go through this discussion of anxiety that upsetting thoughts tend to stimulate upsetting emotions and vice versa, and that these automatic thoughts and automatic emotions, as Beck termed them, also affect behavior, and people begin to behave in very automatic ways as well. I've written about this quite a bit in a book called The Automatic Self, which you can get at Amazon, and it discusses in detail how once these processes begin to replicate themselves in situation after situation, they become habitual and very difficult to stop. So automatic thoughts and automatic feelings almost have a life of their own, and they tend over time to progressively generate problems in physiology. In biofeedback, we know that these constant surfacing automatic thoughts and automatic emotions reduce peripheral vascularity, that they increase heart rate, reduce heart rate coherence, that they cause changes in muscle tension, physical pains like headaches from muscle tension in different areas of the body, and that this cascade of physiological activity tends to increase levels of cortisol and norepinephrine in the brain, and these in turn generate in the long term excitotoxic and inflammatory processes in the body. So looking at the work of Engels et al., we find 3 categories of learned automated responses to fear with the neurophysiological correlates that we were just discussing. Anticipatory worry of the future, which usually involves questions like, what if the world ends tomorrow? What if all the banks fail? What if somebody I don't like gets elected? What if my friends don't like me? The reactive physiological present form of anxiety is a response to an immediate stimuli usually. This is something that could be in the form of a phobia, fear of driving, of heights, fear of being observed by others. And then ruminative or routinized anxiety, looking at the past. In this type of anxiety, we're usually involving a review of things we've done that were not what we wanted to happen, that made us feel uncomfortable, usually eliciting experiences of shame and guilt, and involving questions of why did I do that, or I shouldn't have done that. Beck has actually listed a whole variety of thoughts, there's about 12 of them, categories of them, that describe the actual type of thought patterns like minimization or black and white thinking or catastrophizing. These categories of thoughts are really commonly found in these different kinds of anxiety. Here is a qEEG of a brain experiencing oxidative stress due to severe anxiety. You can see that the beta in the front in this map is elevated, particularly in the front under high beta. Some of that frontal beta may likely be due to frontalis muscle tension. In fact, it's more than likely due, if we look at the research of Witham et al. Looking down at the raw EEG, which is a representation of this person's EEG in this map, we can see in the frontal leads a lot of beta spindling. Jay Gunkelman noted that this was a particular phenotype that is commonly found in EEG mapping, and this is one of them. This type of spindling can be seen especially in the second frame and the fourth frame very clearly as it increases and decreases, almost like alpha spindles but in the beta frequency range. This kind of spindling results in a lot of emotional instability, anxiety, obsessive thinking, and is very common in OCD. Here is some of the metabolic and asymmetry information related to that same map. We can see in the lower right-hand corner very small scores, 1s and 2s, in the metabolic categories, and in this particular measure, 15 or higher is usually a significant score. So this person's not experiencing a lot of physiological discomfort, metabolic discomfort, because this is early in the oxidative stress cycle. We can see in the asymmetry maps, however, there's quite a bit of red in the right side in the beta indicating anxiety, and quite a bit of red on the left side indicating emerging depression, probably irritability at this point. If we look down at the cognitive emotional response assessment, the CEC response assessment in the lower left corner, we can see attention is showing numbers in red and memory is showing numbers in red. This person is rating themselves as having a lot of attention and memory problems, which is also fairly consistent with high cortisol levels that result in degradation of hippocampal function. It's very common for people to start having memory problems during anxiety when it gets very intense. We can also see that the anxiety score is almost at an 18 down there. That also indicates it's getting close to the cutoff when we would expect a very significant clinical anxiety to be reported. Now here's the map of somebody who's suffering from a panic disorder. In this map we can see how diffuse the elevated beta is as well as the diffuse elevated high beta. We can see that both in absolute power and relative power here. We notice that the beta dominates to the point where there's a diminished amount of low frequency activity. A lot of the areas are starting to show blue, lower than normal. And if we look at the asymmetry, we see a strong beta asymmetry, quite a bit of red on the right side indicating a very overactive right hemisphere, a lot of norepinephrine flowing there and a lot of stimulation of the right hemisphere amygdala. And again, as we often see, the emerging of alpha on the left and depressive features and irritability. If we run a LORETA analysis on the same map that we just saw with panic disorder, we find that the majority of the current source is aggregating in the right frontal region, which is the area identified by Engels et al. As most commonly overactivated in panic disorder. So that matches their findings. And if we look down at the ISI measures of anxiety and depression, we see elevated anxiety moving into a clinical range over 15, and even some emerging depressive features being reported as well. The metabolic analysis of the individual with panic disorder shows yellow in hypothyroid, pituitary, and cardiovascular, showing moderately high levels of significance. And then we see adrenals are elevated as well, which are a slightly lower level of significance. So adrenals are 1 standard deviation, and cardiovascular, pituitary, and thyroid are at 2 standard deviations above normal for clinical population. This indicates that this person has quite a few metabolic problems and that their endocrine system is fairly dysregulated at this point. The third type of anxiety map that we want to look at in relation to Engels' work is the one on rumination. Typically in rumination we find elevated posterior beta. These findings were also reported as far back as the late 80s in the journal Science of other people experimenting with EEG and symptomology. Notice also that we have a strong beta asymmetry with an even stronger alpha asymmetry in the lower section showing symmetry, and that anxiety is high, but depressive features are starting to show up above 20 and getting into a pretty good clinical level of significance. People who ruminate, think about the past, are usually engaging in a lot of shame-based thoughts and behaviors, and the posterior part of the brain is constantly active, going over past scenarios. As we mentioned earlier, the initial stages of stress often involve alpha deficits, and as anxiety begins to increase, we begin to get that left frontal anxiety, which was reported by Engels as one of the unique kinds of anxieties, and that's anxiety about the future, anticipatory anxiety. We can see also in the dominant frequency map below that alpha is in normal range in terms of dominant frequency. Now, this is typical of the initial stress stages. Later on, we're going to see when the thyroid becomes dysregulated as a consequence of growing physiological inflammation related to the stress, we'll see that this alpha down here begins to turn blue under the dominant frequency area, and alpha begins to slow into the 8 Hertz range. Here is the metabolic profile of that person with a lot of long-term stress, and you can see that they're starting to show gastrointestinal and gallbladder problems, even though their anxiety and depression is still pretty low and not showing any clinical significance. This is what distinguishes the stress with the low alpha values and increasing frontal beta values, and that this kind of stress affects the body, as we said, increasing adrenal output, cortisol levels, increasing norepinephrine in the right hemisphere, and this activity often gets the hypothalamic pituitary axis very active, increases the acidic levels of the body, and this is what Watson and others were talking about in terms of fast oxidizers. This increasing acidity also involves the stomach and the gastrointestinal tract. This in turn changes the flora in the gastrointestinal tract, often resulting in serious gastrointestinal problems. This is not uncommon in mammals in general. In fact, most of the early research done on animals and stress in laboratories showed that when the animals died from excess stress, the failure stage, hence Selye's 3 stages, they usually died of gastrointestinal problems. Now in this map you'll notice that alpha is low, even theta is starting to show low, which may be a lack of emotional awareness, and frontal beta is high. We're getting into more advanced stages of beta and adrenal fatigue. Even the beta and the high beta is starting to show elevations. We can see that the brain is going so fast that we've even got fast alpha in the dominant frequency section just below those head maps. And then the third tier of head maps down below show again beta asymmetry and alpha asymmetries that are quite mixed. In this more advanced stage of anxiety, we're starting to see elevated pituitary, adrenal, and kidney issues. Hyperthyroid is pretty strong. Blood sugar levels are very unstable. That's common with people with this kind of anxiety. So you can see that all of these metabolic areas are starting to degrade as a consequence of the chronic adrenal output and the chronic cortisol activity in the body, not to mention the hypothalamic pituitary axis activity. The whole body begins to tire, and eventually we'll start to get some inflammatory processes, since the immune system is usually suppressed in this chronic condition, and suppressed for chronically long periods of time, allowing pathogens and other problems to occur. This is a pretty good roadmap for this metabolic degradation process. This is from an endocrine endocrinology textbook. It shows that the problems that are developing can emerge either from a cognitive stimulus, that's physical or emotional, or that a non-cognitive stimulus, which is viral, bacteria, or tumors. And the response of the body to these stimuli is increased adrenal activity and elevated cortisol levels that impact the hypothalamus and the hippocampus and suppress immune function. Now, we took a clinical sample of individuals with anxiety, and we compared their anxiety levels with their symptoms of adrenal problems from the metabolic checklist. And when we looked at the comparisons, we found a 0.719 correlation between anxiety measures on the ISI and adrenal symptom measures on the metabolic checklist. So you can see there's a tight correlation between anxiety and the symptoms of adrenal fatigue. Now, the symptoms of excess adrenal activity are elevated levels of adrenaline, increasing aldosterone, which in turn raises levels of sodium and potassium. Anxiety, irritability, and nervousness are often features of this phase. There's increased blood sugar, increased blood pressure, and individuals tend to be irritable, easy to anger, and suffering from acute stress. There's an overproduction of cortisol, leading to increased inflammatory responses, and overproduction of testosterone, and often seen in the qEEG as excessive fast wave activity, as we showed previously. The fast oxidizer typically has fast heart rate, shallow breathing, and breathing from the chest more than the diaphragm. In this frame here to the right, you can see a heart rate variability panel showing the disturbed heart rate of somebody who's a fast oxidizer, and the little blue bumps in the lower left-hand corner of that panel show them trying to relax and get their heart rate normal. They almost do it in one section. There we have a large excursion, but not very successfully. They're showing a lot of stress. On the left side is their hair analysis test, showing them as a fast oxidizer. A fast oxidizer is somebody who has a calcium to potassium ratio less than 4 and sodium magnesium ratio greater than 4.17. The lower the calcium potassium ratio or the higher the sodium magnesium ratio, the faster the oxidation rate. So this is what we're seeing here in this particular hair analysis. The characteristics of fast oxidation or the alarm stage of stress. Well, people who are fast oxidizers metabolize food at a rate faster than required for optimal energy production and basic body function. Fast oxidation causes cell membranes to be too permeable. It impairs nutrient availability in some cases because too much passes from the blood into the cells. Individuals in the fast oxidizer category are stuck in fight or flight. They often have excessive thyroid activity and excessive adrenal activity. Here's a map of somebody who's even more highly stressed than the previous one. And we can see a deficit of slow wave activity with some left frontal beta because of worry. We can see a strong beta asymmetry, but even a stronger alpha asymmetry emerging. Dominant frequency. We look at the third tier of head maps here. We can see that there's a lot of fast wave alpha. And if we look at the interactive self-inventory and the anxiety measure, we can see that it's very high into the clinical range with the emerging depression coming up behind. In looking at the metabolic report of this individual, we can see that pituitary, gastrointestinal, and adrenal measures are starting to elevate, and physiological problems are starting to occur, but we're not quite at that point where we have inflammatory processes emerging. Well, how does stress affect structure and function of the brain? Very good research on that. Sean Koff and Garner looked at the effects of toxic stress on the American population and found that it was probably the cause of 60 to 70% of adult physical health problems. Stress causes hypertrophy of the amygdala, leading to hypersensitivity of stress, hypertrophy of the orbital frontal cortex, resulting in emotional contextual evaluation problems, reduced hippocampal function, resulting in degradation of memory functions, reduced medial prefrontal cortical function, loss of top-down control, neuronal death, loss of cognitive resources, degradation of neural connections, loss of cognitive function. As a result of all of these, we have loss of general socio-emotional control and increased impulsivity. As chronic stress continues to develop, we also see anxiety becoming more chronically present, and that manifests in a brain map as diffuse elevated beta. We usually have a lot of muscle tension that goes with it. That often causes increases in the map in high beta. We start to see diffuse elevated beta. Quite often the beta dominant frequency increases. People worry constantly. We have the three kinds of anxiety: anticipatory, panic, and ruminative anxiety. So the whole EEG is dominated by beta. We also see a very strong, very marked beta asymmetry, and you can see in the asymmetry in the third tier below, a lot of red in the right hemisphere in the beta frequencies. And here we have the metabolic report on the same individual. We can see that the thyroid and pituitary endocrine system are starting to show problems. The pituitary issue is getting significant with insomnia and constant headaches. And we have the elevated anxiety measures in the ISI. Below that, we can see the anxiety is getting above 15, and depressive features are starting to emerge as well. So, all in all, toxic stress degrades cognitive abilities. It degrades general cognitive abilities, linguistic abilities, socio-emotional skills, developmental landmarks, decision-making, working and short-term memory, behavioral self-regulation, and mood and impulse control.